Hi everyone, if you or your family member has had a recent hip or knee surgery, then this video is for you. I'm Dr. Suhas Raj, Consultant Interventional Cardiologist at Rashtrotthana Hospital, Bangalore. So the topic for today's discussion is pulmonary embolism. So what is pulmonary embolism? If you just ask generally. Whenever there's a blood vessel blockage of the heart, we call it as heart attack. If the same blockage occurs in the blood vessel of the brain, we call it as stroke. And if the blood vessel gets blocked, the blood supply to the lungs gets blocked, then we call it as pulmonary embolism, or you can take it as lung attack also. So when does this usually happen? Usually, as I told you at the starting of the video, if there is a recent hip or a knee surgery and if the patient is immobilized, that is they are not moving, they are bedridden for quite a period of time, or after a road traffic accident or any form of immobilization for a sickness also, then there is a restricted flow of return of blood from the legs to the heart, and in that area in the legs there is a tendency for clot formation. And when this clot gets dislodged from the leg, it can come back into the heart and go to the blood vessels of the lung. And when this gets blocked, the blood supply to the lung decreases. This is what we call as pulmonary embolism. So what happens then when the lungs are not functional to its optimum capacity? It is not able to accumulate oxygen sufficiently, and thereby there is decreased oxygen saturation for the person. So what are the risk factors for this condition? Who are more likely to get pulmonary embolism? If you take, as I mentioned, immobilization, a recent surgery or a traffic accident, or those people who are like cancer patients who have an increased tendency of clotting, patients, pregnant patients, or people taking oral contraceptives or any other hormonal therapy. And the other risk factor is genetic risk factors, where we say the patient generally has increased clotting tendency, where they clot very quickly. We call those patients as people with hypercoagulable states. So what are the symptoms of this pulmonary embolism? The important thing is we need a very high suspicion, clinical suspicion, to actually pick up pulmonary embolism. That's why we want to create awareness about this specific condition. So the symptoms can be as simple as mild breathing difficulty, or it can be as high as a very severe breathing difficulty also. Patient can also have a chest pain, usually what we call as a pleuritic type of chest pain, where this is pricking type of pain. When you take a deep breath or when you turn from side to side, if you are having a pricking type of pain or a chest pain associated with breathing difficulty, few people can also have giddiness, and there's an episode of loss of consciousness, what we call as syncope. These are also associated with as the symptoms of pulmonary embolism. They can also have swelling of the legs with pain of the legs, usually swelling on one side of the leg. There are many people, they do come for a visit with swelling of both legs, which is less likely. It doesn't mean that it cannot happen, but if the swelling of one leg with pain, especially in the calf area, then we have to think of something called deep vein thrombosis, DVT, which can further lead on to this pulmonary embolism. So what happens in DVT? There is a clotting tendency in the leg, in the calf area, where the blood clots, and further when it gets dislodged, it comes back into the comes back to the heart, which that is the right side of the heart, and it goes to the lungs. Heart has two sides, that is the left side and the right side. The left side of the heart usually pumps blood to the whole body. Right side part of the heart pumps the blood to the lungs for it to get oxygen, and it comes back into the heart for it to be distributed throughout the body. So this is why the patient suddenly develops right heart strain, that is a few changes in the heart. So how do we diagnose pulmonary embolism? With the previous symptoms or with the previous history, it becomes easier. The clinical symptoms, as we mentioned. In addition to that, we'll have to take an ECG, echocardiogram, 2D echo, and we also do few other blood tests such as your troponin, NT-proBNP, along with other tests. And for confirming, we also usually do a test called CT pulmonary angiogram, which helps to delineate, similar to coronary angiogram. Pulmonary angiogram helps to delineate where the clots are, what is the clot burden, and what is the prognosis of the patient. We can do an MRA of the pulmonary arteries also, but what we usually do is something called as a CT scan with pulmonary contrast. And coming to the treatment part, it depends on, first it is about the diagnosis, and once we diagnose, we'll have to stratify the patient, that is the risk stratification, depending on the clot burden, the underlying condition of the patient, underlying other risk factors and the comorbidities of the patient. Then we'll have to stratify the patient into low, intermediate and high risk category. Based on that, we do prescribe medications. It is important that you follow the prescription and the advice of the doctors, because the awareness about pulmonary embolism is not much. What usually happens is people usually say, patient is not very symptomatic, I don't have any symptoms, I'm comfortable, I just have a small breathing difficulty, why should I get admitted, why should I take these treatments, should I take these medications called thrombolysis and all. But it is usually the patients are fairly stable, but they deteriorate very drastically. Patient collapse immediately once there is a sudden increase in the clotting tendency. So when the doctors advise for something called thrombolysis for the pulmonary embolism, or we also do a procedure called mechanical thrombectomy, where we take a tube up to the blood vessels of the lungs and we suck out the thrombus so that the blood supply is re-established. What happens when we don't do it? First thing, it is a life-threatening disease, so patient can collapse immediately at any point of time, and it is very difficult to revive. The other thing, if the patient does survive and there's a partial treatment or not a very specific long-term treatment, the patient will have long-term symptoms of breathing difficulty, where their quality of life will be drastically impaired. Even if they walk to a small distance, there will be a significant amount of breathing difficulty, fatigue and giddiness and other associated symptoms, and they will have to be on lifelong other medications, which helps to keep the blood flow stable. It is important that you diagnose early, take the adequate treatment and be on regular follow-up for pulmonary embolism. Thank you.